I really don't have health care right now. I'm going to be 24 in a couple of weeks, and as soon as I graduated from college, I was bumped off of my parents' health care plan. So right now I'm making $8 an hour, working 35 hours a week, and in a few weeks I'll be eligible for Minnesota Care. I really just hope that I'm still eligible after the unallotments that Governor Pawlenty did. But I definitely got the COBRA letter in the mail. I think it's a fantastic program for people who can afford it, especially people with pre-existing conditions. If they can hang on to their current healthcare plan, the COBRA option is outstanding. But for me, I think it was going to be about $400 a month, and without a job at the time, and even with the job that I have right now, that's just unsustainable. I can't possibly pay $400 a month to maintain that coverage. So I haven't had healthcare coverage for 4 months, and that makes me eligible technically for Minnesota Care. I still have to look into it, but it's just a terrible situation, and there's a lot of people like me. There's a lot of young people like me who don't have health care right now, and the jobs that we're looking for don't have health care. Entry-level jobs never give health care benefits. I mean, even with a college degree, I can't find a job in this economy to pay me more than $8 an hour, let alone give me health care. And it's just a really bad situation. When it comes to health care, we pay twice as much as virtually every other industrialized nation to get worse results. We have 47 million Americans like myself who don't have health insurance, and we pay twice as much. It doesn't make any sense. Our health care rating is 37th in the world. That's right below Costa Rica, right above Costa Rica. We have thousands of people, I think it's 18,000 people a year die from not having health care because they go into the doctor's office too late. You say we have, you might say we have health care coverage, we might have emergency care, but sometimes that's too late. And I'll tell you a story about a year ago when I did actually have health care coverage. I cut myself at work, and I tried to clean it out the best that I could, but it still got infected. Well, I went to the doctor, I got some antibiotics, and I started taking them. Well, it was just a cut on my finger, but it spread into the rest of my finger to the point where I couldn't move it anymore. And when I went back into the doctor's office, they sent me to the emergency room to have it cut out, and I spent 4 days in the hospital. And I am very positive that if I didn't have health care coverage, if I didn't have health insurance, I probably would have waited just that little bit longer. And it might have been too late, or I might have been in the hospital for a week or 2 weeks, maybe 3, and I would have lost not only 3 weeks of pay, but I would have racked up an incredible bill. And it's a problem. It's a real problem. I'm a healthy individual. It shouldn't cost very much to insure me at all. And the fact that we spend twice as much as every other nation on health care and have less people covered and worse results doesn't make any sense. So we really need health care reform right now.